Welcome all to another episode of HomeoMitra Vartaalap. Today we have with us Dr Aditya Tiwari. He is a MD homeopath specialized in the field of psychiatry. And so today's topic is going to be about psychiatry, that is mental health, homeopathy, how homeopathy can help all in that sense. So welcome Aditya sir. If you would be kind enough to introduce yourself to us about the work that you have been doing.
Yeah, thank you, Kevor, for having me on your podcast. I've been watching what you do and I greatly appreciate your work. About me, I am a homeopath to begin with, and I've done my MD in psychiatry. So I'm a homeopathic psychiatrist in that sense. I've been practicing since 2008, so about 15-16 years now. I am also a certified arts-based therapist, and I used to do arts-based therapy very regularly earlier. Right now it's a little less, but I do integrate the principles of art-based therapy in my work. And so over the years, I, along with a small team that I've had with me, we have been working in the lines of treating mental disturbances, and at the same time we are planning to restart again on work in preventive mental health area, where life skill building and allowing people to build certain coping skills so that they are able to deal with various challenges of daily life and not come down with symptoms or disturbances. So I think better coping up is what we used to work on. So that's more or less what I do.
So sir, that's quite interesting. Now, when we talk about the term psychiatry, how does a common man understand? If you could just give an idea about when do we know that a patient has a mental health issue or the patient is so-called normal?
I think we need to understand a spectrum of mental health and mental disturbance. The term psychiatry specifically applies to doctors in the mental health area who prescribe medicines. And I mean, earlier it used to be conventional allopathic doctors, and now homeopaths have also been a part of it field. So psychiatrists and homeopathic psychiatrists are people who basically prescribe medicines for symptoms that are coming up in the mental sphere. I think psychiatry can be understood in that way. But to go on to the second part of your question of how do people understand, I think it's basically a subjective experience when you're not feeling okay. So the spectrum that I was talking about of from mental health to mental disturbance to mental disease, it's a build-up that happens. For some it can happen over a period of time, for some it can happen suddenly because of certain factors. When you're healthy, you feel okay, your subjective sense of well-being is good, you are able to do what you have to do effectively, more or less, without too much of an internal problem. Outside challenges are different. So that is where health is. Mental disturbance is an area which is not necessarily disease, not necessarily a disorder, but disturbance. It's like, say, you've not slept well, you've not eaten properly, you are tired, you're fatigued, and then the mental disturbance that come up. So it could be fatigue, or it could be irritability, it could be just feeling low, not feeling enough energy. And this is a place where a lot of people confuse so some people also start calling it depression, whereas it is not the clinical definition of what depression is otherwise understood as. So feeling low, feeling less productive, less efficient, not finding too much of an interest just because you are tired, not because you are suffering from some kind of a deeper disorder. So emotional well-being is disturbed at that time. You don't have enough patience, you're not able to tolerate things that otherwise you were able to tolerate. that is, somewhere, say, the beginning part of the disturbance coming up. When things get severe, when, say, there are symptoms occurring in the mental field, which we understand as either symptoms of intellect, either symptoms of emotions, or of certain behavioral patterns that may come up. When they are overbearing, when you are not able to easily deal with them, or you're not able to cope up with them on your own, they are interfering with your daily life, they're interfering with your work, they're interfering in your relationships, in your emotional well-being. That is where we look at it being more of a disorder in nature, which will require more treatment, or more focused treatment, more medical treatment in that sense. So that's the spectrum of mental issues. Again, see, because this field is so dynamic, this field is so open, even terminologies are misunderstood, words are misunderstood, and I think gradually there has to be a more understanding of how this, from a state of health to a state of disturbance to a state of disorder. If we understand this and where we are in that, we are able to know that only by paying attention to ourselves, self-observation or contemplation, or just checking in on oneself every once in a while. Like when I talk to my patients, I think it's a very regular thing for us to focus that, okay, are you paying attention to yourself? And it's almost like a prescribed activity that at least once a day you are going to do this. You will, in different ways, what may suit a person is, but you will have to sit and you'll have to connect with yourself. Some people meditate, some people who are not able to meditate, they are able to maybe, just journal it out. Some people who are not even able to do that, it's a very simple thing of look at yourself in the mirror and just acknowledge yourself and ask, how are you doing? What is happening with you? So maybe just spending 2 minutes, 3 minutes looking at yourself, not just the cosmetic, but just get in touch with the person that you are. And that's when you know how you're doing. What do you need? Rest? Do you need sleep? Do you need to just correct some things? Or you're more troubled and you need to go talk to someone. Talk to someone doesn't need to be a therapist all the time. Just go talk to a friend, talk to your partner, talk to somebody close. And if that is also not working and you need more specific suggestions, more specific, then go talk to a therapist. I think that's how people can approach.
Sir, I gather two things from here, and the audience, I want you to write down in the comment section so far what you have understood. But what I have understood so far is that physical symptoms and mental symptoms, they are not sometimes very, very different.
Yeah.
More or less, they can mimic each other. And the second thing is that we don't invest enough time or effort, or even awareness, understanding the mental makeup of our own being. We do our hair, we have a bath, but God knows what is happening inside.
Yeah. So some kind of I think checking in on your emotions, checking in on your thoughts. These are the two most commonly used suggestions or inputs that I give to my patients, and it sounds so simple, and a lot of them are like, okay, so this is it, is this it? And I'm like, yeah, this is where we begin with. And once you get into your feelings, then of course you're able to know more. So maybe initially you're able to understand or feel, okay, I'm feeling unwell. It's a very vague understanding. When you get into your emotions, maybe you know that, oh, you know what, I'm actually disappointed. My career, what I thought it would be and where it is going now, I'm not where I wanted to be. I've been doing this for 2 years now. So then you know that, oh, there's a dissatisfaction within which you were not able to articulate, and you were just going, maja nahi aa raha. So that kind of a self-awareness, I think, is the key to understanding what you're going through, how severe it is, or if something needs to be done for it. And again, I think self-awareness, it's been spoken very highly in the spiritual circle or philosophy and whatever, but I think on a daily basis in our daily lives, we need to, I think it's an essential component of well-being, that if you have to be well-being, you at least need to know what you are feeling. That awareness itself is very important.
True. Now this almost sounds like I have some homework to do. Tell me, what do you feel about this? Because certainly there is a lot of introspection and a lot of writing that will happen. And there is also one offshoot that I think we'll take it up in a separate podcast, is when do we learn this, because this is not part of formal education, sir, if I'm not mistaken.
No, I think so. In my practice, I think the formal education that I use is the knowledge of homeopathic materia medica and medicines and all of that. Apart from that, I think a lot comes from what you see around, how you talk to people. I have some I do engage in conversations with teachers who are into Buddhist learnings, way of life, looking at our ancient Indian, I don't know if I can call that literature, but understanding of what life is, looking at what was the teaching that was coming and going into the essence of it. I'm not so ritualistic, I don't get into the rituals so much, but there is a certain wisdom, there's a certain wisdom that is there in what we culturally have been able to understand. And I think if you look at the global movement or development in mental health, a lot is coming down to what these ancient Indian teachings were. A lot of it is focusing on the Buddhist teachings, because the Buddhist monks have been able to take forward the teachings and collaborate with neuroscientists, and the way of life, how do you live a way of life, has become the center of well-being, and that is also the center of mental well-being, because mental well-being is a smaller section of general well-being. So when we align with this cultural heritage that we have, and again I'm talking about the knowledge and wisdom of it, I'm not getting into any religion or any religious practices. I think everybody is free to practice what they do, but getting into the wisdom of it rather than just the mechanical. So say if you are praying, then what does that prayer mean? It's not just ki Bhagwan aap great ho. It's like that I am acknowledging the qualities that you symbolize, and I'm trying to take those qualities for myself. Patience, tolerance, discipline, or general living a good life. I think those things are very, very important components of mental health. When we miss out on those, and this is what we identify when we talk to patients, that where has this person misaligned, and therefore a certain symptom is coming up. So why is there anxiety? Why is there insecurity?
Again, I was not prepared for this. I thought this would be more of a this is mental health, this is illness, this is let's say depression, anxiety, but there's a very different dimension to it.
Yeah.
But on that note, sir, do you think homeopathy has that ability to understand the individual as such from this dimension?
Yes, of course. I think homeopath is the best person to understand this, because the philosophical learning that a homeopath goes through while reading Organon, while reading what I think our master Hahnemann has written. Dr. Hahnemann writes about life. He defines what, like the definition of vital force, I think, is central to it, where we talk about a state of health which is towards higher purpose of existence. Now, he's not defining illness at that point of time. He's defining what normal is. And I think if we know what normal is, then we have something to compare for ourselves, that okay, am I my normal, or am I just going through कि हाँ कुछ symptoms है but I can manage, तो manage कर रहे हैं, अच्छा नींद नहीं आ रही है लेकिन काम तो अच्छा चल रहा है, अच्छा डाइजेशन ठीक नहीं है लेकिन चलो ये तो कर रहे हैं, अच्छा रिलेशनशिप में तो प्रॉब्लम तो होता ही है ना. तो there are so many things which we are just brushing under the carpet as normal, but they are not, and they do take a toll. So we do experience कि हाँ मेरा भी घुटना दुख रहा है, मुझे भी बैकएक हो रहा है, नहीं होना चाहिए ideally. So I mean, I don't know, as doctors I think we should be doing better, but unfortunately we are not. Coming back to the ability of a homeopath, because the homeopath has this view And even in general practice, when say a homeopath is treating a migraine or treating asthma, we do get into these areas. We do get into psychological conflicts. We do get into interpersonal conflicts. We do get into how there is a certain functional fundamental standard on which health prevails, and that is what we tend to educate our patients. So when a homeopath knows this much, it is almost, I think, knowing 60-70% of psychological well-being, psychological disturbance, and how things go. So I think a homeopath is the best person to take this knowledge further and apply it for their patients.
So no doubt now that I understand that, and I hope all of you do write down that if you believe now that homeopathy is perhaps the best, or I would say one of the best ways to deal with mental health issues.
Yeah. So one is about the homeopath, that the wisdom that a homeopath has because of a certain philosophical study, that wisdom is available. That is one part. Second part of that the homeopath has is the homeopathic medicines. The best part about homeopathic medicine is that they are harmless. We know that in modern psychiatry, there are wonderful drugs, medicines that work, that help people, but they also have very severe side effects, and a lot of people get stuck in the loop of that side effects. If they are taking any, say, a mood stabilizer or an antipsychotic, that particular symptom can be taken care of, but there are other metabolic issues that come up. There are other mood issues that may come up. One, say, an antidepressant may trigger a person into a manic state, or get onto the other side. So these things don't generally happen with homeopathic medicines. We are not, because homeopathic medicines are not that direct chemicals which are going in and regulating the brain chemistry. It works at a much deeper level, and of course we can get into those details maybe some other time. But because homeopathy is harmless, it is the best possible medical intervention, because the world of psychiatry is currently divided between one set of people who are completely pro medicines, the psychiatrists and the counselors that work with them, and there's another big section of people who they call themselves user survivors, who have used these medical medicines and gone through those treatments and faced a lot of problems, and then they have survived without those medicines, doing a lot of other therapies which are non-medicinal. So a lot of it's a big mixed bag of things. A lot of talk therapy, a lot of art therapy, a lot of yoga, a lot of group work. A lot of people are very, very almost sworn anti-medicines. So I think homeopathy fits in between these two things, that it is a medical approach, it can go where talk cannot go, but it is harmless. So we don't have to be scared of कि यार ये medicine का ये side effect होगा, कि trembling हो जाएगा and कुछ neuroleptic syndrome आ जाएगा. Homeopathy has the potential to be, I think, the best harmless medicine is how I understand it, in between non-medical and harmful medical. That I think that is where homeopathy fits in.
Sir, I have seen allopathic doctors work on the physical ailments with homeopathic doctors or other natural forms of medicine. I have not yet heard of an allopathic psychiatrist working in sync with a homeopath. Does that happen, or I am ill-informed?
Very nascent stage, I think, as of now. I think these things are, it is absolutely possible. Like I have a contact with an allopathic psychiatrist who is at least not he's not against homeopathy. He's okay with homeopathy. He is not saying ki you treat homeopathically and I will not give medicine. He's not there yet. But he's at least at the place that, okay, you may continue homeopathy, because there are a lot of other doctors who will say ki don't take homeopathy because we don't know what is going to happen. So then, you're on your own. So with that fear, a lot of people don't want to take homeopathy. But I think once we are able to produce results, once we are able to show that, point number one, we are not against allopathy. It's not that allopathy does not have a role. Of course, it has a role. It stabilizes a lot of people. It helps a lot of people. But it has a role only in that space. There's a big scope for therapy, which is popularly understood, where people are solving problems from where these symptoms are coming up. And that is where homeopathy has a big role, because homeopathic medicines do have problem solving capacity also. We've seen it in so many different cases, even in people who come with physical ailments, and there are psychological complexes that we understand. We've seen that after giving the remedy, the patient has not gone through any therapy, but certain resolutions, certain realizations come up. Say somebody is holding on to some grudge and suddenly they realize ki, why am I holding on? I should just let go na, chodo na. And then the physical problems also go away. So this change happens because of homeopathic medicines. Of course, how does this be documented? How this gets into research? How papers are published on these phenomena is a long journey, and I think it's more of an institutional work rather than individual clinicians practicing in clinic, because the nature of work is very different and the resources are very different. So, but I think we'll get there in some time with more and more homeopathic psychiatrists now coming out and practicing. I think it should happen in the next coming years.
It's quite encouraging. In fact, psychosomatics is an established branch of psychiatry, if I am not mistaken.
Yes.
Interesting. So, sir, now what are the common health issues that we see in urban and rural areas of India? Because you have worked in rural areas in your MD, and then you have also worked in urban areas, and I believe you also have done outreach programs in slums and also how?
Well, I think I may not be able to give a very clear-cut picture, but mostly it is similar. I mean, because we have a different population density in cities, maybe thoda idhar udhar hoga, but anxiety is very common, both places. The expression of anxiety can be different. Like in cities, urban areas, we find a lot of panic attacks. After panic attacks comes either depression, generalized anxiety. In the rural area, because these symptoms are not accepted very well. If you're feeling low, then usko thodi koi importance deta hai. Chalo ho to kaam pe lago. So I think there mental illnesses may come up more either in some of the other conversion forms. So either it converts into a bodily symptom, or it converts into some kind of a hysteria where you're falling, you're fainting, or jo mataji aa jati hai vagare, those kind of things come up. But the base of it is anxiety, the base of it is interpersonal conflict. So again, a problem that I don't know if I call it a problem or what, but the way my mindset has become is I don't get too much into these diagnostic labels ki kya problem ho raha hai. My approach is more on what is the problem that the person is going through. So what are the conflicts we are looking at? What are the issues we are looking at? Insecurity, past trauma, faulty coping mechanisms. So my understanding of people have now become more on these lines. I diagnose more in terms of what the problem is or what coping skills are at work and all that. I generally don't get too much into the labels of whether this is depression, whether this is panic attack, or this is whatever, because I've also seen that these symptoms keep changing. A person with anxiety may have a brief spell where a lot of compulsive thoughts just come up, and then we'll like acha to OCD hai, but then that OCD may the symptoms may go away and then we see depression. So do we stick to these labels as watertight compartments, or we look at this as more of a mental state which is flowing from one to the other, or it is a dynamic thing which can change from one to the other? So I personally, I don't know whether this is right or wrong, but I personally have gotten into a space where I don't engage with that diagnostic label. I don't get into a DSM kaun sa category hai. Jo bhi hoga, what lies beyond the symptoms is what the problem I have to solve. So my practice then focuses more on talking, understanding. I do a lot of talk therapy, counseling, psychotherapy, whatever you may call, and along with it, wherever required, medicines. If a person is not directly able to talk or doesn't have enough insight to get into those areas. Then maybe some art forms where a certain kind of a projective technique is used, where non-verbally you are projecting out in some drawings or some doodles, and then indirect ways of addressing it, getting into symbolic understanding, metaphorical understanding. Like there is something called as metaphor therapy, where we talk about some other metaphor with what the problem is. So it's basically projecting it outside, solving it there. Sorry, excuse me. And when we are solving it there, we are solving it within also. And that's how the resolution sets in. And then a person is more comfortable within themselves.
There are quite many variety of therapies. It is not just going to be medicine and talk, as probably people understand. Therapy may in fact even vary from individual to individual.
Oh yes, it does. Again, because see, it depends on what the person is comfortable with. Some people, we need a very cognitive approach, where we are just understanding कि देखो समझो ये तो ये है ये समझो, and when they understand it, it's also them. But some people are like नहीं कि ये तो हमको समझता है, पर फिर भी नहीं हो रहा है कि नहीं, I cannot forgive this person. I understand what you're saying. I understand this is okay, that is okay, everything, this helps and all that. But still I'm not able to. So then there are emotional blocks. Then there are certain, I think, blocks within a person which they are not aware of. So then getting in, more detail or using other techniques, like there are hypno processes, there are regression processes, there is something called as an inner child healing, a process in itself. There is something called as ancestral healing and family constellation work, which is specifically directed towards understanding dynamics that we are carrying, from our family of origin that we come from, which you may have never experienced in your life. It just comes as a pattern. I mean, it's like how you're carrying your surname. You're carrying a pattern that the family has, and nobody is actually conscious about it. हम लोग ये करते हैं. So being aware of those things, then you realize more about yourself. So like I said initially, it's all about knowing yourself. And the more you talk about knowing yourself with different help and different approaches, that's how you get closer to health. So treatment of mental illness, looking at it as a medical model कि ये बीमारी है, हमको ठीक करना है, उससे ज़्यादा ये इंसान है जो भटक गया है, हमको उसको उसके अलाइनमेंट में लाके we have to get the person to himself or herself. And that is what health is, according to, I think, what I am growing to understand.
I think he has simplified it to the last bit. जो इंसान भटक गया है उसको बस सही राह दिखानी है. मतलब I am just appalled that ये तो हमको पता था.
Exactly.
But then still why are we, हम इतने भटके हुए क्यों हैं?
क्योंकि हम कहाँ भटक गए ये मालूम नहीं है. We don't know our location. वो जो geo coordinates होते हैं ना. So when you are lost, you know you are lost. Okay, but you don't know where you are. So you don't know which direction to go to. And I think that is where is the job of a therapist that comes in. कि we will be more like मार्गदर्शक या गाइड होता है ना, कि देखो ये है, you are here and you need to reach here. And in the process, of course, they discover themselves, we discover more about them, and the more we know about them, the better we are able to guide them.
To put this into perspective, हम बल्ब चेंज कर सकते हैं, ट्यूबलाइट चेंज कर सकते हैं, लेकिन अगर वायरिंग खराब हो तो उसके लिए इलेक्ट्रिशियन को बुलाना ही ठीक रहेगा.
हाँ, और फिर वो इलेक्ट्रिशियन आपको हेल्प करेगा कि देखो यहाँ पे ये वायर कटा है, वो है, इसको रिप्लेस करेंगे, ये खाली निकल गया है तार, इसको जोड़ देंगे, वो जो भी डैमेज होगा विल आइडेंटिफाई. बट the good part about identifying is you know what to do about it. Like in a very basic simplicity, what I talk to my patients is, you are irritable. Okay, what is the solution for irritable? नहीं मालूम. उस टाइम पे calm down नहीं होता है. Now if we say you are irritable because you're hungry, you've not eaten for the last 8 hours. Now what is the solution? Of course you have to eat food now. Okay, you've not slept for 2 days. And you're doing something and you're irritable because the sound is irritating you. What is the solution for irritability? Please go rest, catch sleep, and then come back again. So when you know the problem, or when you know about the problem, I think 90% of the times you know the solution. ठंडी लग रही है तो क्या करना है? आपको चादर ओढ़ना है. पर ये आर्टिकुलेट करेंगे कि ठंडी लगी है, तब वो चादर आएगी.
सो आई थिंक जो इलेक्ट्रिशियन वाला एग्जाम्पल था, इट इज एक्चुअली ट्रू.
Exactly.
वायरिंग में गड़बड़ है तो
yes.
समझ में ही नहीं आएगा, ठंड लग रहा है तो ओढ़ेंगे कहाँ से.
हाँ. सो पहले तो पता करना, एंड दैट्स व्हाई आई थिंक द प्रोसेस ऑफ डायग्नोसिस इज नॉट diagnosing the entity or diagnosing the label. It is diagnosing the problem that the individual is going through, and therefore diagnosing the individual. ये इंसान कौन है? And that is why in homeopathy when we say that homeopathy does not treat illnesses, homeopathy treats the person. So that is why homeopathy is the much better suited intervention. And the homeopath who has a habit of identifying and understanding the person is the best electrician who can understand this, क्योंकि उसको वायरिंग समझता है. वो सिर्फ बल्ब में नहीं रहेगा, क्या चाहिए हो गया तो नहीं, बल्ब चेंज कर दो, और बल्ब चेंज नहीं हो रहा है तो हाँ आपका नसीब खराब है, ये तो यू हैव टू लिव विद डार्कनेस, आप दिया जला लो. ये फिक्स नहीं है. यस, ये भी हेल्प करता है, अंधेरे में दिया भी बहुत हेल्प करता है. So it is of
But
value.
then that is the limitation. Beyond
That is the
it will not, जो वो क्या बोलते हैं, जो भटके हुए को राह दिखाना है वहां तक नहीं लेके
उसको बोलेगा आप यहाँ हो ना, यही एक घर बना लो, आप यहाँ रह लो, इसी को मान लो अपना सच. सो वो जो लिव विथ इट वाली बात होती है, एंड इन सम केसेस इट रियली वर्क्स व्हेन वी लुक एट वेरी सिवियर साइकोपैथोलॉजी which have gone so deeper or so structural as we understand. There is something called a structure irreversible. तो कोई भटक इतना गया कि वो नहीं आ सकता है,
तो फिर वो
ये डायग्नोज जब हम कर लेते हैं तब उसको वहां पे बसा देना अच्छा होता है. बट हर कोई जो भटक गया है उसको वहीं बसा दो इज नॉट द थंब रूल. यू अंडरस्टैंड कि ये इसका रिवर्सिबिलिटी कितना है, ये कितना डीपर है, एंड दैट जस्ट अ डायग्नोसिस लेबल डजंट गिव यू. लाइक जस्ट द लेबल ऑफ बाइपोलर, जस्ट द लेबल ऑफ स्किज़ोफ्रेनिया, इट डज नॉट गिव यू दैट डेप्थ. So bipolar in what kind of a person? Schizophrenia in what kind of a person? बहुत लोग रिवर्स हो सकते हैं.
This is interesting, huh? I mean, like homeopathy में मैंने, I mean, what I understand is even two people are not different. So similarly, two people with schizophrenia would also differ, and therefore the medicine and therapy and the guidelines will differ.
Yes.
I was about to come to the next question about how to become aware of mental health issues, but you have more or less now elaborated on that.
I think getting into a practice of any sort. I mean, if you may be playing a sport, you may be dancing, or you may be doing anything, just going for
even
a
that
walk.
is something that can actually help you get into touch with that, like playing a sport or simply walking, or
but not just that. I think taking an additional effort to articulate it,
to make sense of it.
हाँ, कि मुझे ये अच्छा लगता है, मुझे टेनिस खेलना अच्छा लगता है, या मुझे स्विमिंग करना अच्छा लगता है, या मैं गिटार बजाता हूँ. ये अपने आप को बोलना मालूम तो है ही, बट वो जब कॉन्शियसनेस में नहीं आता है आप उसको यूज़ नहीं कर पाते हो. जब आप कॉन्शियसली, आपको पता है, जैसे इट्स अबाउट नोइंग अबाउट व्हाट यू आर एलर्जिक टू, कि मुझे पीनट्स का एलर्जी है. अब ये कॉन्शियसली याद है तो आप पीनट अवॉइड करोगे, नहीं तो हर बार खाने के बाद याद आएगा अरे मेरे को तो एलर्जी है, ये सब तकलीफ हो गया, चलो अभी कुछ लो. सो व्हेन यू आर्टिकुलेट, you are bringing it to conscious. When you are articulating, you are reminding yourself, and then you act from it. So when you know the good things about you, कि मुझे बोलना अच्छा लगता है, तब आप ज़्यादा बोलोगे. कोई बोलेगा नो मुझे लिखना अच्छा लगता है, तब आप ज़्यादा लिखोगे. मे बी दैट इज़ when you articulate कि अरे मैं लिख सकता हूँ. That may give you some motivation कि okay, let me now write a paper and publish a paper or something.
So no wonder, there are times when one feels that, doesn't feel that sense of stress, or, it, as in if you have to make an effort to actually do it. Is that what?
Like for example, see, you are a homeopathic psychiatrist yourself, but here you are talking to people, you run a podcast. This is something that naturally comes to you. You enjoy doing this. I mean, I'm sure you're not doing this because somebody's told you. करने में मज़ा आता है. तो जब मैं ये कर रहा हूँ ना, मैं अपने पोटेंशियल को जी रहा हूँ. एंड दैट इज़ व्हाट हनीमैन टॉक्स अबाउट हायर पर्पस ऑफ एग्जिस्टेंस. हायर पर्पस डजंट नीड टू साउंड लाइक समथिंग, कुछ हर किसी ने कुछ नोबल ही करना चाहिए. ऐसा ज़रूरी नहीं है कि दान धर्म ही करना चाहिए. ऐसा भी आपके अंदर का जो पोटेंशियल है, आप उसको पूरी तरह से जी रहे हो, ये आपका हायर पर्पस ऑफ एग्जिस्टेंस है.
Sir, then therefore I will end this topic with this example that इवन दोज हु आर, जो हम बोलते हैं ना मजदूर, अरे देखो बेचारा कितना मेहनत कर रहा है बेचारे पे, बट देन दैट मैन इज द हैप्पीएस्ट मैन ऑन अर्थ.
If that person is one with what they are doing,
हाँ.
वो जो करने के and complete acceptance of his circumstance, his life, then that's a healthy person.
And then we see the flip side is that someone who is making millions and billions, but look at them and they don't.
They're not able to sleep. They're not able to handle relationship. There's too much of alcohol, smoke, so many other substances, and just creating problems for self, feeling going through those problems, putting problems over other people, relationships. It's a big problem. So again, I mean, even that person, once they get in touch with them, so like when I deal with people who are say too much into alcohol, I never start with कि आपको अल्कोहल छोड़ना पड़ेगा, अल्कोहल आपके लिवर के लिए खराब है. उनको मालूम है ये बात. सिगरेट मत पियो, कैंसर होता है. I mean, तो पैकेट पी लिया.
हाँ, वेल एजुकेटेड दिखता है सब जगह पे.
They know, still they do it. So me telling them is not going to change. We need to get into, are you aware that you need to smoke? What is that feeling? वो जो अर्ज आता है, आपको मालूम है अर्ज आता है. I think 80% of people नहीं मालूम होता है. टाइम पास के लिए अभी कुछ करना नहीं है, वेटिंग फॉर अ फ्रेंड, तो क्या कर रहे, तो यू आर नॉट स्मोकिंग आउट ऑफ एन अर्ज, सो यू जस्ट स्मोकिंग इन unnecessarily. There was somebody who used to smoke 40 cigarettes a day, and I'm like, how do you know that one is over and the second one has started? I don't know. एक बार में कितना सिगरेट जाता है नहीं मालूम. I'm like, okay, अपन एक काम करेंगे. Every time you pick up a stick, that cigarette, just check, do you want to smoke? If you want to smoke, smoke. I'm not stopping you from smoking. मैं आज तक किसी को बोला नहीं हूँ कि स्मोकिंग छोड़ दो, कि ड्रिंकिंग छोड़ दो, कि कुछ नहीं. आपको सच्ची में करना है, अंदर से वो वन, आर यू फीलिंग लाइक इट, देन डू इट. This person started doing that. After 2 weeks, I asked कि ठीक है, how much are you smoking? It's come down to 20. मैंने कहा वाह, क्या किया? कुछ नहीं, just जब भी लगा कि नहीं, I don't really want to, so then I put that cigarette back कि नहीं करना है तो नहीं करना है. I'm like, fantastic, continue this only. And we were talking about other things. Smoking was not even the focus of our discussion. We were talking about some other problems. Again, 2 weeks later, this person came in a little annoyed, almost angry on me, saying, I am not leaving my smoke. And I'm like, don't, but what happened? They told me, कितना हो गया? मैंने पूछा, how much are you smoking? 8. And I'm not giving up on those. I'm like, don't give up on those, but you're smoking 8, right? How? Same thing. So now, this person, because so in love with the smoke, no problems. For that person, 8 times you feel like smoking and 8 times you satisfy yourself. This was enough. The other 32 cigarettes were just mindless. तो हम लोग ने हंसते हंसते ऐसे मजाक में बोला कि ठीक है, हम लोग ना अभी माइंडफुल स्मोकिंग करेंगे. सिमिलरली हम लोग माइंडफुल ड्रिंकिंग करते हैं. दैट यू आर गोइंग आउट सैटरडे नाइट एंड यू वांट टू पार्टी. आपको मजा करने के लिए सच्ची में दारू चाहिए, एक 5 मिनट अपने आप को दे दो बस. आर यू एबल टू एंजॉय विदाउट अल्कोहल? इफ यू आर, वुड यू लाइक टू जस्ट नॉट हैव अल्कोहल? ट्राई करके देखना है तो देख लो. आई हैव एटलीस्ट 4 पीपल who have given up on alcohol. कि नहीं, क्योंकि इसके बाद में जो संडे को जो सुबह तकलीफ होता था, अब वो नहीं होता है. मज़ा का मज़ा कर लिया. I'm like, you can get high on music, you can get high on people you are with. So are you aware of what you are doing? This is why I think I'm hugely sold out on awareness. कि आपको अगर पता है आप क्या कर रहे हो और सच्ची में वही करना चाहते हो तो प्लीज़ करो, आपको सेटिस्फैक्शन मिलेगा. आप नहीं मालूम आप क्यों कर रहे हो तो वो आपको परेशान करेगा. सो वर्किंग ऑन अवेयरनेस आई थिंक सॉल्व्स अ लॉट ऑफ प्रॉब्लम्स ऑटोमेटिकली.
Awareness is that connect and disconnect between health and disease.
Yes,
and I also feel that probably by this time someone who is listening to this and who has had, I believe, any form of addiction.
Please just try it out. Anything that say, whatever you want to do, some like people overeat. वो एक एक्स्ट्रा लड्डू, एक एक्स्ट्रा गुलाब जामुन, एक एक्स्ट्रा या 1 सर्विंग ऑफ बिरयानी मोर, डू यू रियली वांट टू हैव इट? आस्क योरसेल्फ. व्हाट आई डू फॉर माई सेल्फ, आई मीन जब भी मुझे कुछ खाना होता है तो मैं अपने आप को तो कहती ये मैं लालच में खा रहा हूँ, मुझे मालूम है इसके बाद पेट में तकलीफ होगा. कॉन्शियसली नोइंग द कॉन्सिक्वेंसेज आई एम लाइक कि नहीं आज मैं खाऊंगा. I will spend 4 hours whatever with that distress. So on other days I'm able to say no कि नहीं आज लालच नहीं आ रहा है, नहीं खाएंगे चलेगा, it's okay.
So simplified, something which people can do it on a day-to-day basis.
Yeah, please.
पैसे नहीं लगेंगे इसके.
And I think नहीं पैसे नहीं लगेंगे, और आप प्लीज कमेंट में लिख के बताइए कि ये सच्ची वर्क करता है कि नहीं.
हाँ,
So I mean keep a track if people are able to give feedback on this, it will really work.
Certainly sir. So बट आई डोंट नो अभी ये क्वेश्चन पूछूं कि नहीं, हाउ टू प्रिवेंट, बिकॉज आपने तो ऑलरेडी बता दिया है कि जब अवेयरनेस ही आ जाएगा तो ऑब्वियसली प्रिवेंट हो जाएगा.
हाँ, पर 1-2 चीज़ और भी है इसमें प्रिवेंशन में. आई थिंक अवेयरनेस एक चीज़ हो जाती है एंड देन डूइंग समथिंग अबाउट इट, बिकॉज अवेयरनेस में हमेशा सब अच्छा ही नहीं आएगा. अवेयरनेस में सबसे पहले तो आएगा कि हमको प्रॉब्लम क्या है, तो जब वो प्रॉब्लम आएगा उसके लिए कुछ करना ज़रूरी है. बिकॉज I think that is the most important, that is more important than the profession that we are into. I think somehow all of us are very driven mainly by profession, कि professional success मिल जाए तो बाकी सब चलेगा, problem होगा तो. But that's not a balanced healthy life. I mean we speak to a lot of professionals who are successful and who still have a lot of problems. So knowing that once I am aware of something, I need to do something about it. कि मेरे को अवेयरनेस आ गया कि मेरा इरिटेबिलिटी भूख की वजह से है, तो दैट इज नॉट गोइंग टू सॉल्व योर इरिटेबिलिटी. यू हैव टू एक्चुअली गो ईट, यू हैव टू एक्चुअली गो स्लीप, और यू हैव टू एक्चुअली डू समथिंग अबाउट द कॉज दैट यू हैव आइडेंटिफाइड. कि अरे वो मैंने ना वो किसी का फ़ोन रिटर्न करना था, नहीं किया, और वो मेरे माइंड में चल रहा है, मेरे को परेशान कर रहा है, और मेरा ध्यान नहीं लग रहा है कि क्या बोल रहे हो. सो मेरे डिस्ट्रैक्शन का कारण ये मेरा एंग्जाइटी है. ये मालूम पड़ा, हाँ, oh I'm distracted because I'm anxious. Go answer that call, finish it off, and then you're relieved yourself. Now you're here, now your attention is back to where it should be. So I think doing something about what you are aware of or what you become aware of is that has to be done. Otherwise that awareness is useless. फिर आपने जैसे वो क्या बोलते हैं ना, आधा खाना पका के छोड़ दिया है, उसको खा भी नहीं पाओगे, और जो उसमें एफर्ट चला गया वो चला भी गया.
अच्छा, ऐसा भी नहीं है कि सिर्फ अवेयरनेस और प्रिवेंशन में आपका सब ठीक हो जाएगा. जहाँ तकलीफ है प्लीज अप्रोच द डॉक्टर.
पर वो तो थेरेपी हो गया ना, वो थेरेपिटिक्स हो गया. दैट इज द अदर एंड ऑफ द स्पेक्ट्रम. वी आर टॉकिंग अबाउट अवेयरनेस होता है तो हम अपने आप से जो कर सकते हैं और उससे प्रिवेंट हो जाएगा,
तो जाना नहीं पड़ेगा.
हाँ. सो बेसिकली व्हाट वी आर टॉकिंग अबाउट इज हाउ पीपल शुड वर्क सो दैट दे डोंट हैव टू कम टू अस. That is what is the focus of prevention. But when you identify that yes, I am in trouble and I'm not able to sort it out by myself for whatever reason, I don't have the energy, I don't know how to, whatever, that time you need to talk to someone, talk to a professional, you need to talk to whoever. I mean, reach out to your family doctor. If the family doctor is able to sort it out, he will sort it out, but if not, he will guide you to somebody. Go to that person. I mean, even if it is an allopathic psychiatrist, go to an allopathic psychiatrist. At least go somewhere and talk.
And then you can also Google a homeopathic psychiatrist, because it's a very, very official and real thing.
Yeah.
There is a degree which is given by the government. So yes.
I think if I may share a small anecdote, when I started my practice, this was 2009. I remember I went to a polyclinic. And they asked me, so what do you do? So I'm like, I'm a homeopathic psychiatrist. And I'm like, hey, ये क्या होता है? आप homeopath हो ना? मतलब हाँ, homeopath तो हूँ, लेकिन homeopathic psychiatry is my post graduation and that's what I've done. ऐसा कुछ नहीं होता है. I'm like, हाँ, नहीं होता था. I come from the first batch of Bombay University. अभी शुरू हुआ है कोर्स Bombay University से. पहले नहीं था कोर्स ये. Of course, people were treating. I mean, our teachers were treating earlier. बट ऑफिशियल ऐसे डिग्री या ये सब नहीं था. दे वर लाइक, अच्छा सच्ची में होता है क्या? नहीं, मतलब एंड होम्योपैथ्स का नाम ऐसे भी खराब है, हम लोग कुछ ना कुछ. सो दे आस्क्ड मी कि नहीं, वी वुड लाइक टू सी योर डिग्री फर्स्ट. सो आई हैड टू टेक माई रजिस्ट्रेशन सर्टिफिकेट इन डिग्री एंड शो देम कि देखो ये बॉम्बे यूनिवर्सिटी का डिग्री है, लेजिट है, वैलिड है, एंड आई वुड लाइक यू टू पुट अप अ होम्योपैथिक साइकियाट्रिस्ट ऑन द बोर्ड रादर देन जस्ट अ होम्योपैथ. देर सेइंग कि नहीं हम होम्योपैथ लगा देंगे, आप क्या पेशेंट को करते हो वो आप देखो. एंड आई एम लाइक नहीं, खाली होम्योपैथ मत लगाओ. I want to put psychiatrist as my designation, and so they checked my degree. So yeah, it is a legit thing, and you can Google, and you'll find many. I think back then we were not so many, but I think आजकल तो बहुत सारे लोग हैं और बहुत अच्छा काम कर रहे हैं सब लोग.
Wonderful. It's very encouraging and useful for the people who are going to listen to this. So the last part of the podcast. Is there anything called as an emergency in psychiatry? Like how we have emergency in physical illness, heart attack aa gaya, ya stroke aa gaya.
Yes, of course there is. And people who get severely disturbed to the extent where they can cause harm to themselves or they can cause harm to people around them. That is an emergency. When they, like how we talk about acute psychosis or an exacerbation of psychosis, very severe depression where a person is suicidal, or very high mania where a person may just get reckless, not understanding what the risks of a certain thing are. कि मेरे को तो 7 माले पे पतली रस्सी पे चलने का है. Now those are emergency situations, and I think those situations are to be handled more. I don't think by just one person or one doctor or one therapist. I think it requires better therapeutic resources, more number of people, because the families that they come from are also impacted by their disturbance for whatever time it has been going on. So to build resources within the family, you need social workers. You need doctors who can medicate, and these symptoms can be I think reduced significantly, so that you can manage, so that you can get through to the person. If say some amount of therapy has to happen, then the person has to at least be in the zone of having an insight to talk. So I think those are definitely challenges, and I think I as a homeopath, I have not had so much of experience handling such cases, and if something like that happens, I do take the help of an allopathic psychiatrist, and that first the person has to be safe, first the family has to be safe, whoever they are living with. Once there is safety, then we can work on whatever the problems are.
So sir, I think perhaps that is where these institutions like those mental asylums, that is where they are of help.
In severe cases, yes. When the family doesn't have the resources, then that can be short term, like a stabilizing stay in a hospital or an asylum, but eventually they have to be integrated with the family, they have to be integrated with the society. That's when you are kind of actually treating them or helping them in their mental illness. Just isolating them in an institution is not the solution. It may be the solution for the society कि ये इंसान हमको परेशान बहुत करता था, अभी उसको वहाँ रख दिया है तो हम शांति में. वो इंसान कैसा है ये पता नहीं है. So institutionalization is not very highly recommended unless there is no other option. Like you are just not able to manage the disturbance. While in the institute there has to be very, very aggressive, intense therapy, both medical, non-medical. I mean, yoga has a big role to play in mental health. So having those kind of things very intensely, so that we are able to get the person out after 6 months or 3 months or 9 months or whatever the particular case may be. Unfortunately a lot of dumping happens कि एक बार वहाँ चले गए ना तो हम लोग शांति में, फिर उसको उधर ही रहने दो, and that unfortunately doesn't help, because then the person who's there feels abandoned, and that abandonment further increases their problem, and that will require more medication, and then when more medications don't help, then we go to ECTs. So then it's a spiral which doesn't really go very well. As far as possible, it has to be solved within the community, and there are a lot of I'm not able to find too many in Bombay, but there are a lot of organizations all over India who are working in the field of community mental health, like taking mental health services to the community, and treating them within their community, building resources within their community. A couple of organizations that I am kind of in touch with is one trust called Bapu Trust in Pune. They do a lot of mental health work in the underprivileged area in Pune. They have a team of therapists, they have a team of arts-based therapy. Arts-based therapy is hugely used in this area. There's another organization called the Red Door. They do a lot of mental health awareness, they do a lot of integration of various non-medicinal and homeopathy. I mean, like what I contribute to that group is the homeopathic resources. And how do we integrate all of these therapies and provide that as an option to people. So I think for emergencies we need these many much more resources than what an individual doctor can do. So yeah.
Well, looks like there is a lot more to cover on this topic. We will perhaps take it in one of the future episodes. Maybe break down those topics. But sir, just to conclude this thing, I've been having this question, and I almost feel like now this word might find its way into the diagnostic manual. Is road rage? Is road rage actually a psychiatric issue? And like, what is your experience? What do you feel about?
What happens is that if the incidence of a certain behavior just keeps on increasing, then it becomes a category. Road rage by itself is not a specific phenomena. It's about a certain kind of intolerance that a person is going through, where they are not able to tolerate certain nonsense on the road. But it's about the person, that it's my low tolerance, because there is a condition called as intermittent explosive personality or that something like that also. Now that is also because it happens intermittently and because there is an explosion of rage, so it's called intermittent. So these diagnostic labels are more descriptive in nature. So yeah, you may have but they're not conditions by themselves. Like how you have a certain fixed psychopathology of paranoia or schizophrenia, a different kind of an understanding where there is a spectrum of bipolar, where depression and mania is what a person oscillates in, or a very specific kind of pathology of OCD, of specific repetitive obsessive thoughts and compulsive behavior. These can be understood more as entities, whereas this is more of not able to, I think, control your temper. Now, it's not a disease in itself, but yeah, it's a phenomena. It happens on the road. So road rage, I mean, they say domestic violence is something which we understand, but domestic violence again is a descriptive word. It's not of the action. It's not the pathology of what it is. Like, it's not a different illness. A road rage wala can also be beating up, people at home. That can also be. So it's more to do with the temper control problem, which comes from different faulty coping mechanisms of, you may have been beaten up or been bullied or what, because then bullying can also come up as another entity. So these entities are more of descriptive of the behavior of a person. They're not really describing the psychopathology. So,
interesting.
Yeah.
So with this, we'll conclude this episode of HomeoMitra Vartaalap. Aditya sir, thank you so much for enlightening us with the knowledge of homeopathy, psychiatry, and there's a lot beyond that in this episode.
Oh yes.
So yes, we conclude, and do watch this episode, do share this with everyone. This is all about general knowledge, and more than that, it is about putting it into your daily use. It's not just about listening and going off to sleep. No, it's not about that. You use this in your day-to-day life and it will help you.
Yeah, so I think practice some kind of awareness about yourself, or just try to know one thing about yourself every day. It could be the same thing, that I was smart yesterday and I continue to be smart today. Acknowledging that itself is okay. At least you're looking at yourself, not just the appearance, but go a little bit deeper than the appearance and just get to know, and then things start to flow on their own. You will have realizations, you will have insights, and then please do something about it.
Right, sir. Yes.
Thank you so much.
Oh,
Thank you.
Thank you, sir.
Thank you.